This is a quick tutorial on what the Bishop score is. You may hear that term. You may see that term in NCLEX. I'm not sure, but I wanted to give you a quick tutorial on Bishop score, who is appropriate to induce and how. This is a chart on how we measure the Bishop score for a pregnant woman. We're going to assume that she's at term because until term we don't induce. So this woman we will assume is at over 38 weeks pregnant at the very least. Okay, we look at the dilatation of the cervix, the effacement or how thinned out it is. We look at the station of the baby, how high up in the pelvis that baby's head is, and the consistency of the cervix and the position of the cervix, which may sound weird, but this position may be posterior towards the back of the pelvis, it may be midline, or it may be right there at the front and ready to go. The higher the Bishop score, the easier it's going to be to induce that person. The guideline is if the Bishop score one gets is less than 7, unless it's a medical emergency, that patient should not be induced. No way, no how, leave her alone. Let that cervix get readier. Once that Bishop score reaches about 8, induction is quite possible, and if necessary, it's probably going to be a successful vaginal delivery. You can see across the top the criteria of 0, 1, 2, or 3. That is how these various indices are evaluated. So if we have someone who's dilated 5 to 6, she's going to get a 3 for that one. If she's 80% effaced, she's going to get a 3 for that. So we're already at 6. Then the station, if she's a -1, she's going to get 2 more points. Consistency, if it's a soft cervix, it's anterior. This woman is really going to very easily be induced, probably by just breaking her water. You don't need to know that part, but just know this lady is probably going to be fine to induce if it's necessary, if she's at 40 weeks and beyond, and she'll probably do fine. If the lower the score, the less we should be doing to encourage vaginal delivery unless it's medically necessary. So really all I want you to do with this chart is be familiar with the 5 different measurements that we evaluate to determine a woman's readiness for delivery. If you were to have any question that gave you a dilatation of 4 and a effacement of 80%, I don't expect you to know that number that you end up with as far as Bishop score, but you should be able to be familiar with someone who's dilated 5 to 6 and 80%. That automatically puts her into a higher Bishop score, therefore she's more inducible. So just be familiar with these numbers and what they mean, and be aware that this is one way that I personally used to really evaluate whether or not it's even appropriate to talk about induction or just leave this patient, this cervix, this pregnancy alone. Let Mother Nature work on it a little bit longer, unless it's a medical emergency. That's totally different. So that's what the Bishop score is, and the higher the score, the less we have to do to induce. Someone with a really low Bishop score, and it's vital that we deliver that baby, she's going to be on cervical ripening to get that Bishop score higher. Cervical ripening would be those prostaglandin cervix cytotac things to get that cervix more ready. You'll learn more about that in skills, I believe. And then so if we do cervical ripening on a Friday night, then Saturday her Bishop score should be a higher number and she should be more likely to deliver. So that's again why we sometimes, what is called ripen the cervix, is to get numerically a higher Bishop score, which gives us a better chance of a vaginal delivery for that patient. If you can't ripen the cervix, that baby's not going to come, just the way it is. So that's just it. Real brief, quick Bishop score. Be familiar.